2, 1. Hello and welcome to Over the Edge episode 4. My name is Luke Erickson, your host of the Over the Edge podcast. Before we get into today's topic, I would just like to say a few things. First of all, I really appreciate you guys' feedback on the past podcast episodes. Obviously, it's still not perfect. It's a work in progress, but you guys are really helping me continue to find things to work on. And now 2 quick disclaimers. First of all, I did just come from a very exciting basketball game, so my voice is a little hoarse. I apologize for that. And lastly, this will be a shorter podcast than usual. We are not going to be doing any interviews this week. We're just going to be focusing on the facts and the policies and do an outro, and then we'll be done for this week. As always, all articles and facts can be found in the description of this video. And now without further ado, let's get into today's topic, which is healthcare. We're going to be looking at Obamacare, the Affordable Care Act, Medicare for All, and also looking at what other nations are doing with healthcare and what's working. And without further ado, let's get right into it. Okay, and welcome back. First thing we're going to be looking at today is Obamacare and the Affordable Care Act. And the first thing I would just like to say is to get rid of maybe a misconception that Obamacare and the Affordable Care Act are 2 different things or 2 separate things. They are not. After the 2016 election, or I should say during this 2016 election, you would have heard Obamacare used very frequently. But after Trump took office, there were very slight changes made, I should say. But Obamacare then became the Affordable Care Act. And most of the policies and implications that come with it stayed the same. So, that being said, we're going to be taking a look at the Affordable Care Act and how it benefits America and some of the implications with it. So, the Act's primary focus when it was created was to reduce the increase in cost of healthcare. Obviously, over time, with inflation and some other factors, healthcare is going to be increasing, or the price of healthcare will be increasing gradually. The problem before was that it wasn't increasing gradually, and it was more increasing exponentially. So there was a problem. They came up with a possible solution with it, and that was the Affordable Care Act. And now some more of the implications that came along with that, some of the other things they added to it was before the ACA, insurance companies could exclude people with pre-existing conditions. This was a big topic of debate during the 2016 election. As a result, people with the greatest health expenses had to go without insurance. They couldn't afford treatment, and they often ended up in hospital emergency rooms with their diseases becoming life-threatening. Obviously, that's not the best, so with the Affordable Care Act, what they did is to make sure that companies could afford these ill patients. And Obamacare, or the Affordable Care Act, promised they would receive many health patients, and it did this by requiring everyone to have health insurance for at least 9 months out of the 12 or be subject to a tax. And the third main component of the Affordable Care Act was that the federal subsidies were put in place to help everyone afford required insurance. I apologize. And now let's get into some of the effects. The first one is that all medical records now must be recorded electronically instead of on paper. Having worked in the health industry a little bit, I know this was very difficult for a lot of hospitals to carry out, considering they had been doing paper records for, forever. But from my understanding now, not only does it make it easier for patients and doctors to get information between hospitals, but like what I'm working on in research, it makes it a lot easier to get patient records into research studies to help benefit society. So the second is that Medicare pays hospitals based on how well you get instead of how many tests and procedures doctors prescribe. Obviously, America isn't like parts of Europe that totally ban for-profit hospitals, but I think this was put in place so that Medicare obviously pays hospitals based on how well you get, kind of de-incentivizes the for-profit hospitals. Thirdly, all plans must provide 10 essential health benefits. You can find those in the description. I'm not going to go over all 10 of those. Next, plans can no longer exclude those with pre-existing conditions, as mentioned earlier. Companies can no longer drop those who get sick. So this is slightly different, not necessarily a pre-existing condition, but let's say someone were to be diagnosed with a severe form of cancer. Their health insurance can't drop them because of that. Another effect is that parents can add their children up to the age of 26 onto their plans. I'm not sure I guess the implications of that, whether it's good or bad, but that's what it is. Also gets rid of lifetime limits and annual limits. Were both eliminated. And what this means is, let's take the severe cancer patient again. If they're in the hospital all the time and they were to exceed number of visits before, they weren't able to get dropped, and the same goes for the lifetime. If they're in the hospital a lot, they can't get dropped by their insurance carrier. Number 9 is immigrants in the United States illegally cannot receive Obamacare or the Affordable Care Act, but the ACA does expand community health clinics to serve them. And you may ask, why do we do this? Or why did they do this? And this was to help influence preventative care for chronic illnesses. So although they may not be receiving all the benefits from having this health insurance, it does prevent chronic illnesses from spreading to maybe people that do have those, and it keeps the American population as a whole healthier. Finally, this is kind of the bottom line, from 2010 to 2017, the ACA reduced healthcare spending by a total of $2.3 trillion, which is pretty impressive. And the total healthcare spending in the United States reached $3.5 billion. So that's the amount of money that the average, or what the American is spending. That being said, we're now going to move into our next section, and that is Medicare for All. So the ACA, this is what Biden is running on, just to pick one of the big candidates. And Medicare for All, this is what you are going to see Elizabeth Warren as well as Bernie Sanders both proposing. Whether or not their looks on Medicare for All are the exact same can't be said. There are different variations of Medicare for All, but the overarching goal of it is the same. The first thing I'm going to address with Medicare for All, and I'm going to try to do this as unbiased as I possibly can, is taking a look at the cost of it. If you've listened to some of the Democratic debates, you'll definitely see that the main thing that Medicare for All is attacked for is the price tag on it. And obviously with a higher price, you do get a lot of good benefits with that, but there is, I would say, comes a point where it could become too expensive. So I'll give you the facts, and you can, I guess, come to that determination on your own. So right now, I believe this was for the 2018 fiscal year for the United States, the national budget was $4.4 trillion. And this is for everything: military, health insurance, veterans, whatever, everything that the United States buys or pays for. And while we are not aware of the exact estimates of the particular proposals of the candidates, similar proposals have been estimated to cost the federal government roughly 28 to 32 trillion over one decade, so over 10 years. So that's, give or take 3 trillion a year. So national budget is 4.4 trillion. This would cost around 3 trillion a year if you were to average it out. Higher estimates do go around 36 trillion, but from my research, the most accurate ones were between 28 and 32. While the campaign estimated for Bernie Sanders that the plan would cost the federal government about 14 trillion over a decade, like I said, most of the research that I found that it would cost at least twice that, if not more. But one thing that I will give Sanders props for is that he has at least started a plan to kind of figure out how to pay for this. Sanders' campaign plan includes roughly $11 trillion of tax increases, which could fund more than 1/3 of the Medicare for All if it does go the way, or I should say the price, that is estimated. And now some of the effects, or what do we get if we're spending all this money, I guess. Medicare for All would include no deductibles and no co-payments. It would not restrict beneficiaries to networks of care and would offer a broad suite of benefits including dental care, vision care, transportation for the disabled and low-income patients, certain dietary and nutritional care, which I think is very interesting, long-term care, and other long-term services and support. One thing I will comment on it, and this isn't biased towards either the Affordable Care Act or Medicare for All, nothing about mental health. Personally, I think this is a big issue when you're looking at both gun control and just wellness overall, but we're going to stay away from that right now, but that's just kind of my take on that. And so you may be asking, why do we need all this? Why? Obviously, it has a lot of great benefits, but why do we need it? The answer to that people will give and even people who are against it will, I think, acknowledge at least, is that there are estimated 27.5 million people in the United States that are uninsured right now. Obviously, that's a high number, little under 10% of the United States population, but still a large number, and I would say definitely a topic or a good debate point for wanting Medicare for all. I hope you guys enjoyed those two, looking at what the Democratic candidates are running on right now. We're going to switch over now. Different continents, I should say, different countries. We're going to be taking a look at other nations' healthcare, specifically the two that are rated highest for their healthcare, and that is France and Japan. So starting off with France, they have a similar to a Medicare for all, but there are some differences for it. They do have co-payments and deductibles, but they are very, very small. And so the French healthcare system is funded in part by obligatory health contributions levied on all salaries. So this is paid employees, employers, the self-employed. This is also paid in part by central government funding and in part by users who normally have to pay a small fraction of the costs of most acts of healthcare. In most cases, patients have to pay a flat fee for any visit to a general practitioner. So if you go into the hospital, cost in 2019 is 25 euros per visit. In perspective of the time taken, but is higher for visits to surgeries open at night or at the weekends and for home visits as well. Pretty much what that's saying is the price can fluctuate, but most of the costs will then be automatically reimbursed to the patient by his state-run health insurance provider, leaving the patient with between 0 and 6 euros to pay for a standard trip to the doctor, depending on the type of healthcare insurance he has and the age or medical condition of the patient. So it's different from Medicare for all in the fact that it's not just one insurance that everyone has. As it mentions, there are different insurance providers, but they all follow these common rules. And sorry, that is one thing I should have mentioned about Medicare for all earlier, is that it will eliminate all private health insurance. So you will not be able to have private health insurance. I would be interested to see what that does for, I guess, health insurance in general. Obviously, there's billions and billions of dollars that are being made and distributed through that. So I don't know how that all goes down. So, and then the third part of it is that government and private emergency services are provided. So in each large town or big cities, there is a government-run, let's say, ambulance. And if there are large accidents or something like that, they will go there and that will be taken care of. There are also private emergency services for smaller things, but I thought that was just an interesting fact about that as well. Okay, now that we have covered France, we're moving on to our second and final nation that we're going to be looking at for healthcare, and that is Japan. So Japan has a few kind of interesting parts to their health insurance. And so the first part of it is a statutory health insurance, which applies to everyone who is employed full-time with a medium or large company. And what happens with that is approximately 5% of salaries are deducted from the employees to pay for this statutory health insurance. And that cost is also matched by the employers, which I think is pretty interesting. And everyone who doesn't qualify under the statutory health insurance is covered through the national health insurance, or NHI. And this includes self-employed people, such as digital nomads or just an entrepreneur, I guess. And it also extends to those who work in small businesses and or are unemployed. And how much the national health insurance you pay is based on your income. In general, the government will pay for 70% of healthcare costs associated with medical appointments, hospital visits, and even prescriptions, which I thought was interesting and something that's slightly different from France. Patients pay for the remaining 30% of the cost. However, based on your income levels, this ratio may change in favor of the patient. So if you are more low income, it's likely that the government will pick up a larger percentage of this. And by law, Japanese hospitals are a nonprofit. So as I mentioned earlier, for-profit hospitals in America, I think that kind of makes it sound very evil, and it's not that bad. But the Japanese hospitals are nonprofit by law. Governing and administrative decisions are made by physicians, and clinics must be owned and operated by physicians. So you can't have companies that own these large hospitals or have a collection of hospitals, I guess. As you could see, like Health Partners has several hospitals. So while physical healthcare standards are superb, Japan is not as progressive in terms of mental healthcare, and this is something that's very similar to the United States. Practices like isolation or restraints are long discounted as primary treatment tools in other countries and are relatively common in Japan. Assessing mental health treatment remains stigmatized, particularly among women in Japan. So this kind of goes back to what I was saying before. I believe across the board, across all these nations, a big, big thing that needs to be looked into and maybe just covered by health insurance is mental health. I think it's a huge problem in the United States especially, and that's just my take on it. So my question for you guys listening at home, since I don't have interviewees for this episode, is what healthcare plan are you most in favor for and why? And do you think a $28 billion plan is doable? And is it worth it based off what I've told you? I encourage you to do some more research on this if this doesn't really answer all the questions you have. But yeah, that's it. We went over Obamacare, Affordable Care Act, same thing, Medicare for All, and then some other nations' healthcare systems. We have a lot of sources for you guys. So I really hope you enjoyed that. But thank you for listening to this week's episode of Over the Edge, where we covered and talked about healthcare. Obviously a little bit of a shorter one this week. Hope you guys enjoyed. Maybe you guys want to see more podcasts like this in the future. Wherever you guys are listening, though, whether it's Spotify, Apple Podcast, or another platform, drop a follow. We have an amazing schedule coming up in the next couple weeks, and I really want you guys to hear it. So wherever you are, drop a follow. If you guys have any questions for me or want to be a guest on a future episode or have topic suggestions, stuff you want to hear, be sure to go to www.theotepodcast.com. At the bottom of the page, there is a way to get into contact with me if you have any questions. I think we did pretty good. It's short, sweet, but good. Lots of information to take in. Hope this guy's helped you form a little bit of an opinion, so you guys can be more informed come 2020. As always, have a good rest of your day, and go Utes. If you made it this far, I am so sorry for all the voice cracks. We'll be healthy next week, hopefully. Thank you guys. Again, love you all.
Oh, thank you.